Accessing healthcare in Lagos is about to get a major digital facelift. The state government is stepping up its ILERA EKO Health Insurance Scheme, making it mandatory for residents to show proof of enrollment before accessing public services. With a new pay-as-you-go model and stricter enforcement at government offices, the goal is clear: universal health coverage for every Lagosian. Here's the breakdown. At the 2026 first quarter media parley in Alausa, the message from the Lagos State Health Management Agency was firm: health insurance is no longer a luxury. Under a new executive order, the state has moved into a no ILERA EKO, no service regime. This means if you are visiting a government MDA for official business, your insurance status will be verified at the door.
Let's not forget that health is a fundamental human right, and we are not here to deprive people of their rights. We are here to just ensure that everybody keys in so that we do not lose lives needlessly. So it is not a matter of we are carrying cane and stick around and beating up people on the road if you are not complying. It is more like moral suasion, that's what I call it. I'm putting in some gatekeeping policies so that it will kind of guide you and try to compel you towards coming on board onto the scheme. One of those ways, for instance, that all the MDAs, that's ministries, departments, and agencies that are public interfacing. For instance, you want to renew your license, you want to enroll your child in a school, etc. Those are public services. And when you come for those public services, once we are done and we are now fully implementing, once you come for those public services, you'll be required to show that you have health insurance coverage. Once you are able to do that, there is no problem. If you do not have, they will be able to support you in getting yourself enrolled so that you are still yet not deprived of that service, but you get on board.
Recognizing the current economic climate, the agency also launched ILERA EKO EasyPay. This digital wallet allows residents, especially those in the informal sector, to save for their premiums incrementally over 3 months. For 15,000 naira for individuals or up to 80,000 naira for large families, coverage triggers automatically once the balance is hit.
Residents are asking for flexible options of payment. Things are changing drastically, so we needed to respond to provide an initiative that can avail people the opportunity to pay small, as we say. So they will pay money into their electronic wallets in conjunction with our partners. And when this amount of money completes the full premium, for instance, 15,000 for an individual, they can be activated and they can access care at the hospital end.
To appreciate the governor of Lagos State for what he has been doing so far. However, I want a prompt response when it comes to approval of treatment and the likes.
Thank you, ILERA EKO. I read my book, and thanks for my teacher and my parents. They teach me how to read, and thank for God that I carry first.
So I just want to say a big thank you to the organizers of this competition and then this event. Thank you for honoring me with this award. I really, really appreciate it.
But it's not just about those who can pay. The state has tripled its equity fund for the vulnerable from 1 billion to 3 billion naira. This ensures that indigent residents identified at hospitals can be enrolled on the spot.